The USAID-funded Health Finance and Governance Project started in Vietnam in 2014, partnering with the government. At that time, 72% of the country's funding for its HIV program came from PEPFAR and the Global Fund. With Vietnam's graduation to middle-income status and evidence that the HIV epidemic was slowing, the time was right to discuss the evolution of the program. The government of Vietnam decided that social health insurance would be the primary domestic financing mechanism for its HIV response. In 2014, HFG became the principal provider of technical support to the government of Vietnam on this financing transition. Within the first year itself, we produced evidence to confirm the viability of SHI as a primary financing mechanism. Since 2015, the project supported integration of donor-funded HIV outpatient clinics into the SHI system. Our technical assistance contributed to strong national progress. 74% of all OPCs moved to full integration by September 2018. With our support, the SHI coverage for HIV services increased. We supported the development of a policy to enable provinces to allocate funds, thereby ensuring 100% of people living with HIV have health insurance cards. We also advocated for provincial support for subsidized SHI premiums for lonely need. When technical assistance started in 2014, only 40% of ART patients were enrolled in SHI. By 2018, coverage more than doubled to 84%. As the current law does not allow coverage of HIV prevention services by SHI, in partnership with the Ministry of Health, we are developing evidence for including HIV prevention services under SHI to support revision of the law on health insurance in 2020. Technical support has enabled the MOH to prepare for the first procurement of ARVs using the SHI fund. Now, in January 2019, patients will receive ARVs through SHI. HFG advanced the financial sustainability of the HIV response in Vietnam for people living with HIV, their healthcare providers, and of the SHI fund. Analysis showed that many PLHIV would face economic hardship if they had to pay for a lifetime of treatments. We worked closely with Vietnam Administration of HIV/AIDS Control and 4 provinces to develop a subsidy model for ARV co-payments for patients in need. We facilitated SHI contracting for treatment facilities and initiated a process with Vietnam Social Security and VAAC to harmonize information systems for reimbursement to facilities. We worked alongside VSS to develop an SHI projection model to forecast annual financing flows for better planning and management of the SHI fund. We also worked with VAAC to develop an HIV projection model that will inform VAAC's budget planning and advocacy for domestic funding.
Em thực sự ra nhà em nếu không có thẻ bảo hiểm thì chắc là chết, không có điều kiện để mà đi chữa bệnh. Ví dụ như chúng em cũng có lúc ốm yếu phải nằm viện cũng nhờ vào thẻ bảo hiểm thì mới tồn tại được đến ngày nay.